Hello, Dr. Flechsenhar. It's great to have you here with us at the second edition of Neurotrauma Simulation Center. Can you tell us a bit about your background and focus in your practice?
Well, I'm a neurologist working here in Vienna now for 4 years. I've been working before in most of the time in Germany in acute neurology and also in rehabilitation.
And what motivated you to be a part of this program here at the Simulation Center?
I actually was just asked if I would like to help out, and now I'm here. But I think it's fun.
When it comes to the approach of neurotrauma, which do you think is the most pressing challenge, the biggest problem?
The problem, I think, is that there are not so many institutions that can take care of a full problem. Mm-hmm. There are a lot of hospitals with only neurologists or only neuroscience, neurosurgeons, but where the whole team comes together is not so many spaces. Only big hospitals, university setting or something.
So you think that a setting like this one here with the Simulation Center can benefit? Or?
Yes, definitely, because you can learn how to interact in this complex problem, because you need all disciplines working together.
Mm-hmm. Can you tell us about maybe one of the most interesting cases you've ever encountered or something you remember?
Well, I remember one case when I was an assistant doctor, but that was actually trauma in the spine, because it was a young guy, maybe 20 or something, who was jumping in head first in water, and he broke his neck almost, but he was not dead, but he had a
What was the turnout? Did he?
Yeah, there was a lot of discussions because they didn't know how to operate on him, because the neurosurgeon said this is something for the orthopedic doctors, and the orthopedic says, yeah, but we can't do this without the neurosurgeons. But and then they had to both operate on him from the front and from back, and it was very complicated and long rehabilitation.
I can imagine.
Yeah.
When it comes to medical practice, what are some gaps that should be addressed when it comes to the neurotrauma field?
Well, I think most of us don't have intensive care experience. We work in emergency settings, and we work in rehab settings or on normal wards, maybe stroke units, but intensive care and how to manage the acute, super acute situations, almost no one has real experience.
So when it comes to a guideline that should be developed, for example, AMN is working on a guideline in partnership with several societies. What do you think are some topics that should be prioritized in a new guideline?
I don't know.
Maybe like rehabilitation or more practical activities like this one here. Do you think what should we focus on the most, basically?
Well, I mean, there is no real neurotrauma expert doctor, is there? The profession neurotrauma expert is not existing.
I guess so, yeah.
So if you want to have a guideline, you can say, okay, we need this profession. We have an extra education for maybe 6 months or 1 year to get a neurotrauma specialist.
Right.
This could be something to improve education, right. Because if there are specialists, maybe one per ward.
Yeah, so it's a rare.
No, that's not existing, actually.
Yeah, okay.
Yeah, maybe someone calls himself a specialist because he has seen a lot, but there's not a standardized curriculum how to become a neurotrauma professionist, at least not as far I know.
Well, that's it. Thank you so much for your time.
Yes.
Thanks.